We do a lot of things at Infinite Eye Care, all the way from frames and lens selections, adjustments, prizes, contact lenses, LASIK consults, eyelid cosmetic consults, dry eye management, nutritional supplements, etc. The list goes on. But today, I want to talk about one little small portion of one small thing that we do, but it's the most important and passionate thing to me, and that's your eye health. All right, you can start the presentation there. Okay, so this is what we see in this field of life. This is what we see when we're sailing along, and things look pretty beautiful, right? But you don't realize that there's a lot underneath that surface. There's a lot that you don't see. Sometimes when you're sailing along the smooth aspects of life, things look pretty beautiful, but you don't realize that there's things beneath the surface that you might not be aware of, right? And so the eye conditions can be the same thing. You have the surface of the retina, that's just the lid. There's a whole series of things going on underneath there that you don't know about until now. Before we looked at the photos. Luke was nice enough to mention that today, and this is a great technology. A lot of people don't even have this, but this is kind of older technology now that we can just see the surface of. But what if you could see underneath the lid? There's a lot of things that you'd be seeing that you can't see in the other technologies. So introducing the OCT Eye Wellness. And the sound doesn't sound good. Okay. Oh.
What is your eye exam missing? Did you know that sight-threatening eye diseases often have no outward signs or symptoms in the early stages? And did you know that state-of-the-art technology can help your doctor see early signs of these diseases? Did you also know that early detection and treatment of eye diseases may reduce your risk of vision loss? The Eye Wellness Exam is state-of-the-art technology that lets your doctor see beneath the surface of your retina where signs of disease first appear. Traditional eye exams and retinal photography do not provide this level of detail. Regular eye wellness exams can help your doctor detect common eye diseases such as diabetic retinopathy, glaucoma, and macular degeneration. Diabetic retinopathy is damage to the blood vessels in the retina caused by complications of diabetes. The eye disease, if not detected and treated, can severely affect vision. Glaucoma is a disease in which the nerve fibers suffer damage, permanently impacting vision in the affected eyes and progressing to blindness if untreated. It usually develops without obvious symptoms and is called the sneak thief of sight. Macular degeneration is an eye disorder that damages the center of the retina, macula, making it difficult to see fine details. It is caused by damage to the area around blood vessels that supply the macula and is a leading cause of vision loss for Americans age 55 and older. The Eye Wellness Exam is a quick and non-invasive scan of your eye that lets your doctor see the layers of your retina to aid in the early detection of eye disease. The scan is quick and takes just a couple of seconds to complete. Ask us about the Eye Wellness Exam today.
Okay, so now you know a little bit more about the procedure, or the test, I should say. So let's go over a little bit of something that you should understand before I go on. These are the 4 most important slides, so pay attention. This is the anatomy of the front of the eye, or of the back surface of the eye. The central thing over there, that's the optic nerve head, that part that joins to the brain. This is the macula, blood vessels, and all this is retina. And up until now, that's all we really knew about. But maybe we should find out if we can go deeper. Can you advance that over there, James? Or Chris, excuse me. So that last one showed that there's a lot beneath there. So this surface right up here is what we were looking at in the photograph. Now we have the ability to look underneath the surface. And so here's that typical scan you were looking at on the video, and it shows all these things that are going on down here. This is the kind of the meat and potatoes that I didn't know about before, and now we can actually see stuff before it happens. Advance, please. Back, please. All right. So, and this is the most important slide that I want you to see. This part right here, see that green? Green is good. That's all you got to remember. Green is good, all right? So let's go through a couple scenarios here. Here's that retinal photograph that we used to look at, which is great. This talks about something that looks a little bit abnormal. But now when we do that OCT eye wellness test, you can see over here, something doesn't seem right. What's not right? It's not green. Very good. You're very fast learners, Chamber. So you can see that something doesn't seem right about that. So we investigated a little bit further, and I said to the patient, you need to get back here a little bit more soon because we want to see where this is going. Well, this is where it was the day one, and the person didn't get back to me till 6 months, and we ended up having a separation of the retina. Something, again, that I wouldn't have been able to see before with other technologies. Here's another case that looks a little bit bad, and of course, again, you can see that here's the non-green screening, and there's something going on over there on that one side, so we got to investigate and see what's going on. And in that slide, the person has what's called an epiretinal membrane that's been pulling on the macula and pulls that off. It's created a macular hole for the person. This is going to affect their vision and needed treatment. Oops, back up once. Shoot. I'll let you advance it, or back one. There you go. So here's one last slide, because this shows the green again, but there's green over everywhere, but over here there's something going on. And there you can see that this person has a choroidal serous retinopathy, which is a separation down beneath the layers of the rods and cones as well. So all these cases are things that we knew something was going on before, but we didn't know what was going on. And now we can see it happening and possibly fix it before it gets to that stage. Here's something that I used to look at that looked like macular degeneration. To me, it looked like macular degeneration, but when you do this scan, you can see these, once again, this is a retinal pigment defect, and that's got the same type of signs and the same kind of symptoms, but a different kind of treatment. So now we can do that properly. One last statement, and this is a couple of the biggies. I mentioned macular degeneration and glaucoma. Everybody knows about those two, and this is what they look like. Here's something that seems a little bit elevated, so what's going on? Well, let's investigate a little more closely, and you can see those little crumply lines there. Crumply isn't good. We all know that, right? Straight is good. So that's got an early macular degeneration, and that person needs treatment. And then here's a person that came in and just a standard screening, and it looked a little red on one side over here. And what does that indicate? Early stage loss of ganglion cells, which means glaucoma. That glaucoma needs to be treated. Okay, so let's go ahead and move on. So bottom line is deeper better? Yes. Does OCT eye wellness diagnose earlier? Is green good? If we diagnose earlier, can we treat earlier? All right, you all get an A for the day. Just real quick, a lesson about myself. Me and Tammy opened up Infinite Eye Care in 2009. It was a blank shell. Moving forward, we put the place together, had a nice place, but there was some shortages and some things missing. Advance, please. There you go. All right. Back, and this is what it looks like today. And this is Jeff helped me a lot with this. This is where we brought in a new station. So now we have another station to dispense glasses, another 250 frames. So we have over 1,000 frames in Infinite Eye Care to choose from. And this is my staff. You saw them earlier. I tell you what, you get a family behind you, you'll go anywhere in life. That's all I can tell you. And I really appreciate that, you guys. And of course, behind the scenes, you guys have probably met Cindy, and of course Jeff is the man of the hour in my office. He really gets things going off the ground, so we couldn't do it without him. This is my family, Tammy and our 3 kids. And you know, we do a lot for you, we do a lot for ourselves, but what do we really enjoy? We enjoy doing stuff for the community, and these are just a few examples of a lot of the ways that we contribute to the community. Some of you probably recognize yourself or your company names up there. But one of the biggest things that I want to talk about that we do is the Strides Against Breast Cancer Walk in October. This is a beautiful shirt, and I tell you what, pick up those pink slips on the tables. I don't want to see one of those sitting here before I leave. Even if you take them out and throw them away, I don't care. I want you to join our team this year for Team Infinite Pink and create a difference for the people with breast cancer, because they deserve a fight as well. Oops. And you can sign up online. Just a couple quick facts about Infinite Eye Care. We've seen nearly 7,000 patients, over 14,000 patient encounters. We've donated over $13,000 to the community, and we have 900 likes. If you haven't liked us on Facebook yet, be one of the additional ones that we need today. Thank you very much for coming, and we hope you will learn something.
Thank you, Dr. Tom.